Okay, this video is called Dr. Peter Attia Corrected. He's part of the Stanford group of speakers, has a lot of views, but usually when I see somebody get a lot of views, a lot of times that just means they're, promoted BS artist, okay? He speaks with confidence. He is a trained physician. I think he started out in surgery, changed his mind. But he acts like he has something profound to say, and then when he speaks, he just says generic stuff, platitudes you already know. And the other thing that I don't like is he takes a simple subject and he jumps into complexity. And it's almost like, it seems to me, he's intentionally trying to confuse people. He's a pretty fit guy, but that's pretty typical of a ketogenic diet promoter. Pretty fit, youngish guy. And so people think, well, he looks good, I'll try doing that. I'm not impressed by him, just so you know. I mean, I think he's intelligent enough. He can speak in an articulate manner. And he does have some knowledge of, clinical medicine and nutrition. But what do I see as a problem? For example, he was on a ketogenic diet. He said for a couple of years he was eating 90% fat every day, and he said he just got sick of it. Well, that's an absolutely stupid diet, eating 90% fat. There's no good fats, okay? They're all bad for you. You don't want to be eating saturated fat is terrible, okay? Omega-6 fats are terrible, and omega-3s are bad for you too. They're increased prostate cancer, obesity, insulin resistance, immunosuppression. You don't want that, okay? It's stupid. All right, and then he still eats lamb and salmon. Salmon's 50-50 food, 50% protein, 50% fat. There's no carbohydrate in animal foods except for in milk. So it's a terrible food. Lamb, and it's all about the same. Animal protein's all pretty similar. And he drinks tea and coffee, so he's having caffeine, a brain vasoconstrictor, an excitotoxin. I recommend avoiding that stuff. He hunts and he eats deer. Okay, I actually respect hunters. Hunters preserve the land in a good way. I respect that. I don't have an animal rights issue. People should be nice to animals, but all I'm saying is that's okay. But I mean, he's part of there's sort of this macho bro science thing. He seems to sort of be of that ilk. He still praises the ketogenic diet. He just says he got sick of it and he wanted to eat more fruit, for example. That was part of what he was saying. He says he has a high-fat shake where he puts in cream and almond butter. He drinks coffee. What kind of health advice is that for patients? I think that's terrible stuff. If you want to keep your arteries open, read Caldwell Esselstyn, 198 patients in a row with no recurrent cardiac events in the 4 years of the ones who followed his diet. Okay, what else does Attia say? So first of all, he's promoting high-fat diet, which I think are bad. Nathan Pritikin said the same thing. Fat is bad. There is no fat you want to be eating. You get enough fat from just eating plant foods and from the fiber in them that gets converted to fat, short-chain fatty acids by your good gut bacteria. Okay, he big time emphasizes the problem of sarcopenia in the elderly. And yeah, it's good for elderly to have some strength, to lift weights, do some resistance exercise. I would agree with that, but I don't agree with what he's saying. He's saying they need to eat more protein. He was emphasizing what seems to me very high amounts of protein intake. I don't like that idea because I'm concerned about elevating mTOR and increasing the risk of cancer. Plus, especially animal protein, it has an anabolic systemic effect on the body to increase total cholesterol levels. I think you're going to accelerate your rate of aging in proceeding towards the Hayflick limit, and you're going to increase your cancer risk. I personally think that's a bad idea. You've had very healthy populations eating very low amounts of protein. Like the Kempner diet was 4.5% protein. Papua New Guinea got 93% of their calories from sweet potatoes, which are about 4.5% protein, okay? And they were quite healthy. The best agers, the longest lived people ever and well documented, were the Seventh-day Adventist vegans, okay? And those are vegans. And they're not even the healthiest vegans because they ate some fat stuff because it was for veganism for religious reasons, part of the Seventh-day Adventist religion, out in Loma Linda, suburbs of Los Angeles in California, rather than purely for health reasons. Okay, so people could even live longer than that. The next after them was the Okinawans, who were eating tons of sweet potatoes and a plant-based diet. And also the blue zones. That's the other thing too. He makes everything so complicated as if no one could understand. Okay, but you know what? Most of these blue zone people, they're all a bunch of illiterates or functional illiterates living out in the way out in the boonies. Okay, Seventh-day Adventists, are the only ones kind of citified. All right, so what I'm trying to say is you don't need to be a genius to eat plant foods, get some sunshine, spend time with your family, spend time with your religious group, okay? All that makes people healthier. And that's another reason why I think I'd give you better advice is because I'll tell you the truth that, number one, you need a healthy diet. And I think the vegan community's done a good job with that. Low fat, low sodium, vegan diet, organic is better. That's all good. But number two, you got to avoid the toxins. And there's estrogenic toxins everywhere nowadays in all the personal care products, in the water, and in the processed food. So that makes you fat. That's another reason why you want to lower your fat intake, okay? And then also psychologically, religious people are just a lot healthier. Okay, everybody's scared to talk about religion except say sit on your butt and say Om and talk to the wall, okay? That's BS. Okay, I just read another book about the history of the Irish, okay? The Catholic Church was the center of the whole community, and it provided homeless shelters, it provided orphanages, it provided schools, it provided all these social events on all the holidays. It provided entertainment on all the weekends. That was good for the community. And it was everybody there because they wanted to be there together and they wanted to help each other. And not them being forced by some, authority above them that doesn't care about them. And you know what I'm talking about. Okay, what else about Attia? So basically he's recommending the opposite of what I would recommend. High fat intake, animal foods, and high protein intake. I think that's exactly the opposite of what I would recommend to people. And then he made some video where he's talking about differences between plant and animal protein. And it was an abbreviated video. I don't know. It's probably something in the ballpark of 10 minutes or something. But, he doesn't get into mTOR with regard to cancer. Okay, he keeps talking about mTOR being a good thing in your muscles if you're lifting weights, that you can have a specific effect to your muscles from lifting weights. Okay, but there's still a systemic effect. And we don't measure it as precisely as we like. Okay, fine. But what I felt from his lecture was he was like splitting hairs in a way to almost confuse people. Say, oh, nobody knows what's going on in nutrition. Just, I like eating these foods. I think they're probably a decent idea. Why don't you try this? There's not, I like McDougall. McDougall says, look, all the healthy populations, they eat starch-based, okay? That's good advice. That makes sense. You can look at the map for yourself. You can see these people. Look at the Tarahumara. Look at the Yanomamo. Look at the Papua New Guinea. Look at the Okinawans. Look at the Costa Rica, okay? Look at the Sardinians. Look at the Icarians. There's a lot of healthy populations. They're all starch-based, and you could just look at them, and that's pretty good information. Epidemiology is some of the best information in nutrition. And then when he talks about coronary artery disease, he starts getting all this ApoB stuff, downplays the effect of total cholesterol. Like I said, nobody's can beat Esselstyn's results. 198 patients in a row that followed the Esselstyn diet didn't have any recurrent coronary events for 4 years in a row. This is July 2014 Family Practice Journal where you'll find that article. Nobody's going to beat that. Ornish had really good results too, moving in that direction with his vegetarian diet. Wasn't full vegan at that time. Okay, where he had some reversal of coronary artery disease. And Esselstyn had some reversal of coronary artery disease as well as no progression. Okay, those are incredible results, all right? So what am I saying? I'm saying that a person can be bright and intelligent, but I don't sense he's taking you on a path that's going to help you, okay? Sometimes if you want to fill out your knowledge of a topic, you can hear from a variety of sources, but I was not impressed is what I'm saying. He says things that I would disagree with, okay, and I think I'm much better informed on this subject than he is. He says the essence of atherosclerosis is in cholesterol in the arterial wall. I would disagree with that. I think the essence of atherosclerosis is the fact that it's a blood clot. I look at CT angiograms every day. It looks like a blood clot, okay? If you read the research of Gregory Sloop, he's the best person to get you introduced to atherothrombosis theory. I've been thinking about atherosclerosis for decades, and atherothrombosis theory explains things by far the best. Everything makes sense with atherothrombosis theory. And William Roberts, a cardiac pathologist, like the best cardiac pathologist that ever lived, he also agrees with atherothrombosis theory. And I see it every day when I look at catheter arteriograms, when I look at CT angiograms, when I look at MR angiograms. That's what fits, okay? Atherothrombosis takes everything else. Like cholesterol theory is a subset of atherothrombosis theory. You can get atherosclerotic occlusions in a sickle cell anemia, 20-year-old who doesn't have any high cholesterol problems. All right. Anyways, no mention when he's talking about atherosclerosis. I didn't hear anything about Esselstyn, Kempner, Ornish, Sloop, Roberts, all the top persons I would consider, and there's other ones as well. Let's see, what else? I think where you end up with him is an analysis paralysis where it's not clear what to do, and it's sort of like, well, little keto, little bit of fruits, some protein supplements, enjoy your coffee. I disagree with all of that. So, anyways, I wasn't too impressed with Attia. I think he does have, he's an intelligent guy, he's articulate, he's pleasant, sort of charming and nice and all that, but I didn't sense people being helped that much, okay? And I can also tell you what some of my viewers have told me. Well, who are you to talk? You don't make any money on YouTube. Yeah, because I don't monetize my channel. I just do this as a hobby. I don't do it for financial reasons. He goes, these other guys, they've got millions of views and they got millions of dollars in their pocket. Yeah, I go, because they're salesmen. Okay, I'm not selling anything. So, anyways, be that as it may. I wasn't buying this, telling people high fat is good, caffeine is okay, high protein is good, animal foods are okay. I see it actually quite the opposite.